Well, a new era of healthcare has begun in this province. The Ford government has passed a health reform bill that will allow more private clinics to offer certain publicly funded surgeries and procedures.
Mr. Calandra.
Mr. Calandra.
Mr. McNaughton.
Mr. McNaughton.
Mr. Lecce.
Mr. Lecce.
Mr. Fidelli.
Mr. Fidelli.
Mr. Ford, Etobicoke North.
Mr. Ford, Etobicoke North.
The government says Bill 60, known as the Your Health Act, is needed to address the province's surgical backlog. Opposition parties, advocates and experts, though, are expressing concerns about oversight, staffing and the upselling of medical services.
This is a step in the wrong direction. And I will say as well, we're talking now surgeries. If you look at what's happened in other provinces where they've gone this route, like in Quebec and in British Columbia, they're now reversing course because the evidence is there. It costs more, and in BC, they're shutting a lot of this down because of illegal upselling of services. So we know that all the research shows that this is not the way to go. There are alternatives. The government should be investing in public health care. They have a huge surplus. There's no reason why we should be going in this direction.
Now, Dr. Andrew Bazari, professor of health policy at University of Toronto, also has concerns about expanding the use of private clinics.
It's, again, we want to see action where the healthcare system has been under huge duress. I mean, that is very clear. Health workers are under a lot of duress. And again, when we've seen what's needed to happen in terms of paying our nurses, retaining the health workforce, expanding things and access to things like primary care, where we know 6 to 7 million people across the country don't have that, it's hard to see how measures that push more to for-profit private facilities are going to remedy those issues in terms of the staffing and in terms of addressing the backlogs for people who need it most.
Meantime, health advocates aren't ruling out legal action against the Your Health Act. The Ontario Health Coalition is holding a community referendum on May 26th and 27th with more than 1,000 voting stations across the province so people can weigh in on the privatization of healthcare.